Great. Welcome back to House Healthcare. We're now transitioning to S37. We're going to hear 3 amendments potentially over the next hour. We're going to start with Representative Higley or Mark. So for everyone, it's on the House calendar at the very bottom of page 1971. It starts. So Mark, I'm going to let you walk us through your thoughts.
Sure. Well, good morning and thanks, Representative Mark Higley from Orleans, Lamoille. So just to start out, again, it's all in section 8 is what I'm trying to do. And to set it up initially, all I'm really trying to do is take out wording of limited services, pregnancy centers, and including everybody. So that would be all pregnancy service centers. And I believe there's 6 limited and 7 Planned Parenthood ones in the state.
Actually, I think there's more pregnancy centers than there are Planned Parenthood.
So anyway, I agree with what's in the findings and the intent, but again, so what I'm doing initially, you'll see in the first instance is following centers that seek to counsel clients against abortion. I'm removing that, often referred to as crisis pregnancy centers or limited service pregnancy centers. I'm removing that, which you can see in the amendment, and then just going on with the rest of it have become common across the country, including in Vermont. That's the first instance. The second instance, it talks about an additional, so it'd be a number 6 in the findings. And basically the wording there is some individuals may be intimidated in receiving services to support the exercise of their rights to choose to bear a child at a pregnancy service center where abortion services are provided. And again, that's just to say, that, with all cases, all folks, there should be an option, it should be spelled out an option. So that's why that's interjected. And again, just going from my own perspective on the intent piece afterwards, talking about the General Assembly respects the constitutionally protected rights of individuals to personal reproductive autonomy, which you can't, I agree with that, but it should go both ways is what I'm saying. And then if you go to the third instance, it's again, removing anywhere where there's the wording limited service pregnancy centers and just including pregnancy service centers, again, to capture everybody, whether they're here now or going to come into the state later. It's going to capture everybody. And again, the fourth is similar, just removing that limited service pregnancy center wording, putting in pregnancy service centers. And then on the fifth, because I've done that, I have to remove the definition of what a limited service pregnancy center is. And then it would just, the rest of the section would just be renumbered.
Okay.
So relatively simple in a way, but that's where I'm coming from. Capture everybody.
So I also, before there's questions, I just want to remind people that the section about unfair and deceptive act, which follows all of this, we're placing into law a new section for unfair and deceptive act because if you remember, we took testimony that free services are not protected under, are not part of a Consumer Protection Act. So limited services pregnancy centers, we have testimony, may not, some might charge for services. Planned Parenthood, we heard testimony, they do charge for all those services. And so that is a distinction here for the overall piece of the section. So I just want to remind everyone of that, but let's ask questions. Maury and then Alan.
Thank you for bringing this to our committee. I do not support the amendment, and I want to explain why for a couple of instances. We'll start with number 6. Some individuals may be intimidated in receiving services to support the exercise of their right to choose to bear a child. In medicine, the process of informed consent is revered. It is a practice that we rely on whenever, especially providers, licensed providers like physicians, nurse practitioners, physician assistants, and to some extent, nurses and other providers to a more limited extent, use informed consent. And that process does not involve any kind of coercion. It's a process by which the provider, with the wealth of their medical knowledge, lays out risks, their assessment of the patient's current condition, and then risks and benefits related to that. But it's not a coercive process. It's a supportive process that allows the patient to make their own decision about which way to go forward. So that's already embedded in practice, and it's a standard of practice. And to go against that would potentially put the provider at risk of an action against their license. So this isn't necessary because it's not something that in general happens in practice. And then I think to strike out the phrase limited services, pregnancy centers would be, to not have that would be misleading, because the pregnancy centers that we're referring to in the limited services don't have, like the ones that I'm aware of here in Vermont, don't have a licensed OBGYN working there that can provide extensive prenatal care. So that's what a full range of pregnancy services would include, among other things that the limited services pregnancy centers actually don't provide. So for that reason, I can't support the amendment.
So the limited services pregnancy centers currently, do they or do they not have a physician on board?
So one of the ones that we heard from had a naturopathic physician, not an OBGYN. So some primary care providers, including naturopathic physicians, have some training may have, but not necessarily, may have some training related to prenatal care, but it's not someone who is an OBGYN, a licensed OBGYN.
And then if I could, just what's the objection to moving all of the pregnancy service centers to these standards?
Can you restate that?
Well, again, by what I've done is include pregnancy service centers. So all of them would be held to these standards here as far as the words on the page, whether it's false and misleading advertising, telling the truth of how trained.
They're already, the actual, the centers that provide comprehensive prenatal services are already held to those standards.
So I guess
In
why?
so many levels, through standards of practice and licensing. And as Representative Houghton mentioned earlier, the reason that we're adding and then further down, the part in the law that would include limited services pregnancy centers is because some of the services they provide are free, so they don't fall within the law. We can't hold them accountable
For consumer protection.
for consumer protection.
And the testimony we took was that not all limited service pregnancy centers potentially, but the ones we have heard from, none of their services is there payment for. Everything is free of charge. And so in order to be able to ensure that they're providing valid factual information, this puts them under the Consumer Protection Act. Pregnancy services centers who already charge are already included under that.
So
I'm gonna
I would love to bring them everybody to have the same, to the standards of care that I'm familiar with in the clinics that provide pregnancy care. Yes, we should all be up to this standard, and the limited services pregnancy centers, not all of them are up to that standard. So we want to make sure they're lifted up.
I'm going to turn it over to Alan.
Okay. You're right. But the thing is, first of all, the question I had was the service centers that you say that they don't pay. Is that federal or state law that they don't have to abide by the rules?
They don't, people don't pay for the services, so they
Right.
offer their services for free. That's their choice.
Right.
And it is state consumer protection law.
State.
Yes,
Okay.
Yeah.
Can that be changed with legislation?
that's what we're changing.
Okay.
That's
So,
what we're
well, okay, but the other thing is, if the ones that are following the rules, not misleading or anything, if they're doing it already, why would they be offended if it's in print for everyone?
Because, and I'm going to turn to legal counsel for the fact that they are already covered under consumer protection.
But if it's in print, it shouldn't even make a difference.
But it's already there. And this is a new chapter specific to
Okay.
them. Does that help, Alan? I mean, I know you don't agree, but
That's okay, thank you.
If it wasn't there, it would be a valid thing to put in, but it's already in
Right.
a lot of places.
Right. Because consumer protection in the state of Vermont only applies when you pay for a service. Art?
Again, I don't see any harm in making a change. I mean, yeah, okay, they have their standard now, but what's wrong with having one document where everybody's in line? That's my. And as far as number 6, just going back here. Let me go back to the top, click on the page. Hold on.
Page 46.
Trying to get,
I got page 46, Art.
well, I'm trying to get the page 1971. There we go. Some individuals may be intimidated receiving service.
This is the second instance of
Right.
amendment, which would change number 6 of the findings.
I think it's important to, and yeah, the idea probably of Planned Parenthood is to give everyone all services, but people being people, maybe some are pushing abortion and folks don't feel comfortable. I don't know. And so having it in there, I don't see the harm in having it in there. Just my opinion.
Alyssa and then Bobby.
So I mean, I think essentially you just want them called pregnancy service centers, correct?
Which would capture
So I guess if I'm looking, if I'm thinking about what the definition of a pregnancy service center are or is, what services do these centers provide that are pregnancy related?
Sorry, say,
What services do these centers provide that are pregnancy related? Do they provide prenatal care?
well, I'm not sure of all the ins and outs because I haven't taken all the testimony, you know.
They have obstetricians working at them?
I'm not sure about that. I just know that,
Do they do routine lab work that's done during pregnancy?
my understanding is, from what I've seen, is they have education classes, pregnancy testing, ultrasounds, a bunch of other tests. And, you know, there is, you know, my understanding is there is a doctor at each facility of these limited.
We took specific testimony that there are no doctors at the facility. They have a medical director. They're not on site. They provide you with a urine pregnancy test, which you can purchase out of any drugstore. You basically pee on a stick. And then they provide an ultrasound that is not read or interpreted by a physician. And other than that, we took no testimony that they actually provide any pregnancy services. So if you call them a pregnancy service center, that is just frankly not what they are. It's just not what they are. The word limited, I would say that the word limited is the bare minimum of what they should be called.
So let's hear from Bobby, and then we'll go back to Mark, and then we'll hear from Alan.
Mine's about a different section. In the second instance of amendment, number 6, when we got testimony from Planned Parenthood, 95% of the healthcare they provide is not abortion. And what evidence do you have that there's an intimidation into getting an abortion when someone didn't seek that? Is there any evidence that there's intimidation going on in places like that?
Well, just personal, from some folks that have talked with me or whatever over the years. Sure, there's always, well, not always, but with some folks, there was apprehension and stuff when they went into it in regards to, you're talking about Planned Parenthood in particular.
I mean, that would be a legitimate complaint that you were going to make for consumer protection, that you were intimidated into getting services that you didn't want. And there's already a process for them to make a complaint. So we never heard any testimony that people had filed complaints against, the UVM Health Center or Planned Parenthood. We heard testimony from both of them. I mean, if there was such a thing going on, we'd like to know, but we never heard any testimony saying that ever happens.
Well, my understanding too is you took testimony that there wasn't ever any complaints with the limited services facilities either.
Right, and the response from the AG on that is there's no process for it today, which is sort of the reason.
There's no form to complain on.
So I'm gonna let Alan go, and then we're gonna give you the last statement.
Okay, just one other question. When we did take testimony, we heard about one pregnancy, right? Now, is this testimony true on all those centers, just the one we talked about?
So the pregnancy center we took testimony from has a couple offices, and then we also took testimony from a different pregnancy center. Yes. And that, that's two different ones we've heard. They heard the same thing as we heard.
Okay.
Mark.
Thank you. Again, regardless of whether you're calling them limited service or not, they provide a service, and it's a needed service. And there was over 1,300 people that took that service, and it sounds like there was no complaints to this point. So again, to me, what it looks like here is you're going after them with these, maybe rightly so, but it should fall across all spectrums. And I just feel that it's an attempt to almost do them in, and I don't appreciate that. And that's what I'm trying to make it look a little bit more even-handed. That's all.
And I appreciate that, Mark. And I want to be clear, and I said this throughout the testimony, that we are not trying to do them in. They do provide a needed service for people in the state of Vermont. We're simply wanting them to provide accurate and factual information, and for that a consumer to have the capability to go through a process if they feel like they weren't provided factual information, same way that other people can do under consumer protection law. So, but I agree with you, they absolutely do provide a service that is valuable to people. Thank you.
Thank you.
So, do we want to vote on each one as we go? Yes, I'm seeing yeses. Okay. Any other discussion?
I would just like to say one thing. I think we also heard that Planned Parenthood doesn't have a medical director on site all the time, I believe.
There's always a licensed provider.
There's
on
always,
site.
I got one quick question. Is there any lawsuits against one of these pregnancy centers from a patient?
Not that I know of.
Okay.
Yes. All right, all those in favor of Mark's amendment, raise your hand. Brian and Daisy, are you coming online?
I'm not in favor of this.
I'm not in favor.
Okay, wait, hold on. Sorry, I just wanted to make sure you all knew we were voting. Okay, those for the amendment 2. Those opposed to the amendment, raise your hand, please. 5, 6, 7, 8, 9. Thank you, Mark.
Thank you.
Thank you, Mark.
Thank you, Mark. Say that. We do.
Oh, jump up?
Yes, please.
All right, perfect.
Good morning.
Morning.
Welcome. All right, so I think Nichols is like one amendment, right? This
Yes,
is on the same.
one simple set of words.
1972.
Mm-hmm,
Okay,
exactly.
12.
Yeah.
I don't know what page we're on.
As far as on the bill, you mean, Art? I think it's page
40, well, I got 46.
36.
So on the actual paper copy of the bill,
Okay.
it's page 23.
Oh, on paper, okay, yeah, I'm looking online.
In subsection 5, which is actually page 24. On the calendar, the amendment is listed on 1972.
One sentence.
Yeah, that I can follow.
Whenever you're ready.
Oh, okay, I didn't know if you were.
Yourself and then go.
Hi, Representative Michael Morgan from Milton in the Government Ops and Military Affairs Committee. The amendment that I've got in front of you folks today is pretty simple and straightforward. And it's just looking for parity or equity, or however we want to say it, in this section where we speak to under number 5, reproductive health care services has the same meaning as in 1 VSA section 150 and includes medication abortion. To include, my amendment is, and support for the choice to carry a pregnancy to term. So in other words, everything's on the table, so to speak. And I'll preface it with, it has a little nexus to what you all were just talking about with Mark's amendment. I did take the time and go visit one of the pregnancy centers, Aspire in Williston. I spent almost 2 hours with them a couple Mondays ago on one of our days off. And they on staff have an ND, a naturopathic something doctor. And I have the definition of that right here that I'll read to you, that just to let you all know that there is a person.
So just so you know, that is the pregnancy center, limited services pregnancy center we had in.
You did?
We talked to Deb.
Oh, you did? Okay,
So,
good.
yes, we understand that their medical director
Yeah.
goes across the 3
Okay.
areas they have.
Okay, good.
And that it is the only licensed position that they have.
Yep, yep. So you're familiar with it? No need to
Yes.
regurgitate that. I didn't know if you all were, but no, it just NDs are primary care physicians, a patient's first stop for medical care. They're considered, they go to 4 years of their version of medical school but anyway, so you all have taken that, so you have that. So I have nothing other to offer than that. It's just an asking for a simple insertion of those words for some parity in the bill with that being said.
So, did you want to say something?
No, but I don't know if you want me to orient you to
Yes,
where you want.
that'd be great.
So Jen Kirby, Legislative Council. So this is in section 12. This is in the,
Oh, I'm sorry. Yeah, go.
has the public institutions of higher education, so UVM and Vermont State Colleges, providing information on student access to reproductive and gender affirming health services. And in the definition of reproductive health care services, this would add that phrase that you see in the calendar, and support for the choice to carry pregnancy to term. So that wherever that term reproductive health care services is used, it includes.
So it's after medication abortion?
Yes.
Yes.
Right. And so, Jen, can you read what the definition is of reproductive health services that we have?
Yeah, and what page is
So right now you have, it's page 24 of the bill you voted out. If you want me to tell you where it is in the calendar, I don't know if people are using the calendar to look at the bill.
No, in the bill, what's the definition of, our current definition of
The
reproductive
current
health?
definition of reproductive health care services, it says has the same meaning as in 1 VSA section 150, so it's the one we looked at yesterday that you're proposing amending, and we may want to revisit it if your amendment today passes just for this reference to medication abortion. But right now it says reproductive health care services has the same meaning as in 1 VSA section 150 and includes medication abortion. The definition in 1 VSA 150, I think is relevant to what you're talking about, means all supplies, care, and services of a medical, behavioral health, mental health, surgical, psychiatric, therapeutic, diagnostic, preventative, rehabilitative, or supportive nature, including medication related to pregnancy, contraception, assisted reproduction, pregnancy loss management, or the termination of a pregnancy.
That's on page 3.
And
That part is on page 3.
Yeah, just so people know where that is, on page 3.
Right, so page 24 refers to the definition that is on page 3. Thank you.
So Jeff, I'd like to understand how, all right, hold on. So would end support for the choice to carry a pregnancy to term appear only in section 12? Or would it amend the definitions of reproductive health care services throughout the bill?
No, it would only appear in section 12. It would sort of be adding some.
And so it would, okay, so wait, I want to make sure I understand. So it would require, I'm going to section 12, hold on. Sorry, very last page. It would require the universities as part of their readiness
Right.
to report on this. Okay. Which
Yes, yeah, I'm sorry, I meant to mention that.
you might have, sorry.
Oh, I didn't, but I intended to and I did not.
Okay,
Correct.
okay.
So we may want to revisit that phrase and that includes medication abortion if the amendment that you are proposing today passes, because it makes it more explicit that it is included. That's sort of a separate issue from Representative Morgan's bringing to you, but just since we're really talking about those words.
Okay. Leslie and then Art.
So I'm back at the definition of reproductive healthcare services, and it says on line 9, relating to pregnancy. So doesn't that include sort of that whole thing?
I think you can read it. You can read the exact existing definition with the supportive nature relating to pregnancy as sort of inherently including, but I think if you wanted to be more explicit, or if there was interest in being more explicit in this reporting, we can look at whether to put it in the definition or to put it in the list of what is getting reported on. So there's also some language. Where are we? So there's also some language in the existing section 12 in the list of what has to be reported on in number 3 about the types of services that are offered and the supports that the institution provides to students who receive those services. You could maybe build that one out to be a bit more explicit if you wanted to be looking at the supports that they provide to students who are choosing to carry a pregnancy and parent.
All right, Art.
Yeah, I actually think this language in C, I think that's what you're kind of saying, Jen.
I think it's sort of implied in C, but I think.
But spelling it out would make it stronger. Reproductive, and what's more reproductive than saying we're going to carry it to term? So to me, and if you put it in C, it carries everything. So.
So I think, I guess the question is maybe, at least for the purposes of Representative Morgan's amendment, is the intent to, maybe that's a good question for Representative Morgan, is the intent to have the institutions reporting on, more specifically on how they're supporting pregnant students who choose to remain pregnant and carry a pregnancy?
Yeah, both. I mean, the full spectrum would be my answer to that, if that makes sense.
So I think focusing on that, I'm a little bit concerned, I guess, and apologies because I didn't mention this to you because I hadn't thought it through. But about amending the definition because it suggests that it isn't included in the 1 VSA 150 definition, and I think it is. It's
Implied in there, you're saying?
Right, it's implied in there. If the idea is to get the reporting on the full spectrum of services that the institutions are providing to pregnant students, I think we can be more explicit about that in the reporting piece.
Yeah, and with the intent that that is I think I'm hearing you're saying it's implied, but I mean, to make sure that that full spectrum is available to that woman.
So would
Right,
we,
and to understand from the
To those women.
institutions what it is that they do to support students who
Yes,
choose to carry pregnancy to term.
yes.
so Jen, would you, if this is accepted, would you recommend it be changed?
I think so. I think it would be probably, I want to think about it a little bit. Because I think.
Why don't we let
Yeah,
you
let me
think and
think about it,
we'll
'cause I
have our
understand
discussion?
Wanting to, the representative's interest in having it apply throughout all of what's being reported on as well. So I want to make sure that I'm not inadvertently limiting him to a narrower slice of that.
Okay. So let's have a discussion and then we'll give Jen time and we can always come back to this later for a vote. So Art, you spoke, right?
No, I'm all set.
Okay, Leslie?
So I have two concerns about this. Thank you very much for your thought.
You bet.
First, I think that the universities haven't started doing anything yet. So they're
Right.
really at the beginning of their process. So it would be very interesting to me to hear what they come up with and see, where the gaps are, and then we can move forward. I'm not sure I feel comfortable expecting universities to take care of pregnant students. That's not their job. Their job is to seek reproductive health care at an appropriate place. So I don't want to imply by collecting this, by having this expectation that we are expecting them to have some kind of care for pregnant students. I don't feel like that's their responsibility. So I'm not comfortable with that. And I'm not comfortable with this amendment because of the implication of what we might be asking of schools.
So you're thinking that, in other words, I'm asking for them to offer the actual care that goes for a woman that chooses to continue with a pregnancy, you mean?
Yeah, I'm looking at your language and support for the choice to carry a pregnancy to term. I don't know what that means for a university.
I got you.
And so what does support mean? And maybe that needs further evaluation, and I'm okay with that at some point as we go forward and, gather the sort of baseline data to see where we stand.
The intent is to, and maybe I need to work that further, maybe comes up with some words that are different, but at least it's so that it's an awareness that you have the ability for them to discuss that is an option.
But I'm not sure that the university's responsibility is to offer options. The university is just collecting data. They're just starting to see what options are available to them on campus.
So I guess that's my question. So
Let me go back to.
So the section says they have to report on their readiness. Are you just asking that they report on their readiness or that they, because, and let me back up. So we heard from UVMMC,
Okay, sure.
that they actually have a health center on site.
Okay,
And so they do provide, you have a cold, you have a flu, different things that you go to the health plan on site and everyone's required to have health insurance.
okay,
If they need a surgical abortion, they'll be referred out to UVMMC. We heard from the state colleges that they don't have any health center on site. So they provide materials if someone's coming forward. And so the first, with the report we're asking for, and Jen, I'm hoping you're listening so I get this right, is that what are they doing today for gender affirming care and reproductive health care?
okay.
We're not asking them in here to be the support or to provide it. We're simply saying, what do you do if someone comes to us, I got you, Art, and wants journey affirming care or reproductive health care. I just want to be clear that you understand what the language, the intent is.
No, that's good clarity. So in other words, not providing any service, and that's what Leslie was saying. I got that loud and clear, but simply,
What do they do if someone comes to them and says,
all right.
I'm pregnant and I want support for bringing my pregnancy to term?
Yeah, so I guess the way I would view that is that simply that all, and if you, and maybe you're gonna tell me it's there, but is or not, but that all options are discussed.
Okay. So there's a difference between all options are discussed, because so at the state college system, if right now, how it is today, from the testimony we heard, if I come forward and say, I come forward with two situations, right?
Sure.
Maybe I come forward and say, I'm pregnant, I want abortion.
Right.
They're gonna say, here are all the places you can go. They just give you pamphlets. Melissa comes forward and says, I'm pregnant, I want help bringing this baby to term. They're probably gonna provide them some of the same pamphlets, but they are actually not talking options from what we understand today, and that's why we're asking.
Yeah, no, that's good. That's good to know,
what we're
yeah.
doing. And our intent is not, and Jen, this is where I want to make sure I'm clear. Our intent in this language is not to require them to do that. We're simply asking them to come back to us with what they are currently doing. Correct?
Yes.
Yes.
This does not actually require them to do anything different from what they're doing. They're just reporting on what they have in place, and it's an annual report, so you can see if that.
So if I understand correctly, then you're saying they are currently, there is that parity, there is that across the spectrum look is given. Maybe I'm missing, I'm sorry.
According to the definition of what reproductive health care readiness and reproductive health care readiness is, I'm reading it as yes, because I'm sorry, I crossed the page.
24.
Well, actually, I'm going page 3. So page 3, reproductive health care services means all supplies, et cetera, or supportive nature relating, and including medication relating to pregnancy, contraceptives, assisted reproduction, pregnancy loss management, or the termination of a pregnancy. So to me, relating to pregnancy and assisted reproduction and a supportive nature would lead me to say, yes, it's all levels of reproductive health care. Sorry, I didn't mean to cut you off. I just wanted to.
I was going to refer to that, because that was a question that I had.
That was something you had in earlier testimony, Topper, you mean?
Right.
Okay.
So
And I felt it was covered.
You felt it was covered. Okay.
The supportive services, et cetera.
Okay.
So I'm not saying so this amendment can, we should still talk about the amendment. I just wanted to be clear that you understand what the section is saying to ensure you still want to put forward the amendment, which if you do, great, and we'll have the discussion about whether we actually need to add the language or not. But this amendment is not requiring them to provide any
Actual service. Understood.
Yes.
In any direction.
In any direction.
Correct.
So what you think, I'm going to let Art go.
Yeah, go ahead. Let me just relook the language I put out there and just ponder that while, y'all talk.
Sorry,
Go ahead.
Yeah, Alyssa's got.
Go ahead, Alyssa.
Before I
Sorry.
would,
Peripheral vision.
Right.
Well, I did raise my hand a while ago, but then you sort of went where I was going. But we specifically took testimony that because of HIPAA, these the colleges don't even know what services are being provided, because all they do is refer. And so there's no way for them to report on this sort of thing. They don't know, once that person has left, they don't know what services that person received, or where they went, or if they went anywhere, or anything. I mean, they're really just there to provide information. They don't actually render
A service.
a service.
So go ahead, Art, and then I think Jen.
Remember, we're just amending a definition. We're not telling anybody to do anything. We're just amending a definition. That's what this amendment does. It amends a definition. I look at all the definitions of reproductive care. I see plenty of things about terminating pregnancy, but I don't see very much, none, about carrying a pregnancy to term. That should be corrected. Somehow, somewhere, it needs to be corrected in language that people can see. Okay, and you can interpret through the words maybe, but we don't have anything in there that says, or carry a pregnancy to term. And I think it should be, without question, either on page 3 or here. It's just definitions. We're not telling the colleges to do it.
I think Jen just came up and suggested something to me, and I think it might cover what you're saying, Art, I believe, but.
I think for a limited purpose, it will. So my suggestion was perhaps we look at, instead of amending the definition of reproductive health care services on page 24, that we look at amending the definition of reproductive health care readiness. And that we, so that we clarify that part of what you are looking for in having the institutions reporting on their reproductive health care readiness includes this. So when it talks about their preparedness in the definition of reproductive health care readiness, each institution's preparedness to provide reproductive health care services to students or assist them in obtaining reproductive health care services. And then we could have including support for the choice to carry a pregnancy to term, having in place equipment, blah, 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 so that it would be, and we can put them in whatever order, but just the idea being that their readiness as they're reporting on it would be, all facets of pregnancy, including, because I think in the definition, the overall definitions, it's talking about pregnancy. So right. I think that suggests the full course of a pregnancy. But I think in this case, what you're really interested in is what are the colleges doing to support students who are choosing to maintain a pregnancy. And so we could be more explicit about that so to make sure it's in the reporting.
So Jen, we're talking about doing it in the reproductive readiness?
Exactly.
Okay.
Exactly, because then when it directs the reporting, it requires in 2502, they all have to report on the current status of their gender affirming healthcare and reproductive healthcare readiness. And then when it talks about these types of services that they're providing, the readiness piece of it is including the support for students who are maintaining a pregnancy.
Right.
Okay.
Okay, Alyssa.
Makes sense to you, Todd?
Yeah, actually, so before I go to questions, does that make sense to you? Would you make a change to your amendment?
Yeah, I think that works. And so you make that, Jen, and
Yep, yeah, we could work with the clerk's office on a substituting. Yep.
You'll take it from
you take it from there, or do I have to go from you to them?
I think maybe we'll go.
Let's wait to see if we accept it before we get all the way there. But I just want to make sure you.
We can propose it.
I want to make sure that you completely understand that we're not talking about providing a service.
Correct.
What we're talking about is reporting what you do. That's what the colleges are going to do.
Yeah, and that's what that section was that it was done under. So if that's all they're doing is reporting that, then, and that's a component of, if that is dovetailed into and that becomes a component of it, great.
Alyssa.
I think the thing that I'm struggling with the most is when we start expanding and parsing these definitions. I think that the definition of reproductive health care starts losing its meaning. And I wonder if people remember that reproductive health care is health care that's delivered to assist reproduction. That is what it really is. And reproductive health care is not all abortion. It's a very tiny piece of it. Yeah. And so when we start adding these things into the definition of reproductive health care, of, like supportive pregnancy, and that's already what reproductive health care is. It is the support of reproduction, which is pregnancy. And I don't feel any need to go beyond what that really is. We add all these little things in there just to remind people that there are pieces that you might not be thinking about. But really, reproductive health care is about supporting pregnancy and bringing new people into the world, reproducing.
All right.
I agree with that. I do appreciate you bringing this. I've been listening, debating in my head whether we could, whether it's needed. And then I kept hearing Representative Black talk. I'm reminded that the rights of people who are pregnant to carry a pregnancy to full term are not under attack right now across the country. The right to choose to have an abortion is, it's, as Representative Black said, reproductive care, reproductive health care, for many, many decades has included and still includes the supportive care, the counseling, all of the care needed to carry a pregnancy to term. And for a very small percentage, if the pregnant person, for whatever reason, and it's not my business as a legislator to figure out what that reason is or tell that person what to do, that's their right. It's a small percentage. So I think the focus, because of the controversy and people's ideological beliefs, has been on abortion, when reproductive care is reproductive care. It already is. That's safe right now. Nobody's attacking anyone's right to carry a pregnancy to full term.
I get that, and I understand that, what both of you are saying with that. And I guess I'll call it a counter, or my answer to that only would be that because of perception in the world, whether it's right or wrong, I see no harm in adding that in. Because I think the average person hears those words today, they think one extreme over the other in a lot of ways. And I'm just doing that as the man on the street listening to people talk about it. I'm not trying to put any bias in. I'm just simply in talking with people in general about that. I just think that's a lot of people imply that, right or wrong, and that's just because that's what humans do. They imply a lot of stuff, as we know. So I'm just putting that out there as no more than what we've just talked about. I'll just leave it there.
Sorry, Leslie, I'm going to go to Melanie since you've already spoken. We'll come back to you.
I just appreciate everyone's points on this, and knowing that there may be language in the study and clarifying that for people. I'd like to see the wording, but I think that there may be merit in putting it there, and I would be concerned about adding it to a definition. I appreciate that you brought this to us.
Leslie, huh? No, it's Melanie's just saying she would like to see the language.
Yeah.
Of
Sure.
where. So Jen, could you work on something?
Yeah, I think I have.
Okay. Can you share it? Can you put it up on the screen? And while you're doing that, I'm going to let Leslie go.
I just want to agree with what was said. I think that it says provide reproductive health care services. That's very broad. And I worry about parsing it. I think we have to remember where this is going. This is going to colleges. It's not going to the person on the street. That's not who we're talking about in this section. We're talking to colleges, and that they need to be able to be clear about what they're asking. And it's very broad. It just says reproductive health care services. It could be anything that involves women's health, pretty much.
Sure.
And women's health is broad, starting from starting with menstruation and moving on through menopause. So maybe there's some college students who need that kind of help at menopause, and that would be cool. So I don't want to have to parse it, right? I think that women's health is broad, and that's why I'd like to leave it broad.
right, we're gonna go to Daisy and then Alan and then Art and then we'll have Jen for language. Daisy?
Hey there, sorry, I'm trying to pull up the exact language because I just had one thought, and it is that putting this into a report, it just sort of begs the question, what are we hoping to do with that data? I'm always wary of having people collect data unless we really have a purpose for it when it comes out on the other end. And it sounds to me like this is something that was prompted by general conversations with people. And I think, you know, supporting the choice to carry a pregnancy to term is, you know, it is such a deep and private thing that if you're going to collect data on it, I think you need to be, and I hope Jen is working on this language. I wasn't clear if this is the direction you were going, but to make it more specific on whether that involved specific tools or services versus a sort of conversational support of carrying to term, because I would not support an amendment that it added that language.
Right, so Daisy, I think the intent is not to put any language in that requires the universities to actually offer a service or provide support. It's just, what do they do today when someone comes to them with a situation? So I foresee them coming back with, well, we provide them literature to these places, or we, you know, set up a time, we offer the opportunity for them to see a counselor and refer them to counselors. I think it would vary depending on if you're at UVM or the state colleges. Does that help? You understand?
It does, but I would want to see more, I still would want to see more clarity of what is meant by support, because I do not believe that we should create any sort of expectation or suggestion that we want to be monitoring the colleges, having conversations with individuals about their choices, because that conversation is a private conversation and it should not be had by any college officials or staff.
Right, and yes, I think there's no heads nodding. I don't think that was the intent when we originally accepted this language, but the original language, so. We'll come back to Jen in a minute to see the language. All right, Alan?
Okay, so we got the colleges involved to collect this data and reports for the best of all healthcare for pregnancies. Okay, so if we've done that, why don't we cover, I would expect them to cover all aspects of any pro-choice, pro-abortion, I don't care.
Right.
Collect it all, and I don't see any harm in putting this in. We're not asking much more of them. We're not saying, you know, provide a service. We just want these patients or to get the best options of their situation.
Right. So they're not patients, they're people.
Well,
right, because there's no, depending on where you are at the state colleges, it's people, and so I think you bring up like what the fundamental debate is being able to receive a service or get information about a service that is to bring your pregnancy to term. Is that already included in the definition of reproductive health care?
That data would be very helpful across the spectrum, right?
Can you say that?
That data that they collect would be.
Right, but the question is that already inherent in the definition of reproductive health care? That's, I think, the fundamental question we're asking right now. Art and then Brian.
Yeah, if reproductive health care services is reproduction, then why are we even defining it? On page 3C, we define it in some detail. And the last piece of it, or the termination of a pregnancy. There's nothing clear to me in here that we also support, and part of reproduction is carrying a baby to term. And to me, it should be in there. We're defining it, so it needs definition. Okay? If it didn't need definition, we wouldn't bother with it. Well, it's defined right here. We should have something in there. I think it belongs here. I don't know about the student part of it. I take that whole section out for me. I don't think we have any business dealing with the colleges at all. But anyway, I think it needs some mention in here. And certainly on page 24, where, you know, we talk about healthcare services plus medicated abortion. Why is that in there? It doesn't belong in there to me.
Tucker?
Without getting in an argument and trying to convince somebody, you know, that has a different opinion than me.
Sure.
I want to just read, and I want you to think, just you, because you're bringing this question up, of a woman that is pregnant, all right? A woman is pregnant, and here's the services she will receive. All supplies, care, and services of a medical, behavioral health, mental health, surgical, psychiatric, therapeutic, all of these things, preventive, rehabilitative, or supportive nature, including medication relating to pregnancy, contraception, assisted reproduction. And then it says pregnancy loss management. That's, you know, if you have a miscarriage, and the termination of pregnancy. That to me includes everything that a woman needs. You know, I could be wrong, and I'm willing to be wrong if I'm wrong, but I don't think I'm wrong. I think that that is providing all the services that a woman would need.
Okay. I disagree.
If I get you.
No.
And you know something, if we lose the ability to talk to each other across the table.
Yeah. No,
What's going to happen, and this is only my opinion too, we're going to lose our democracy. We have to be able to do this back and forth. I respect the hell out of you in terms of why you feel the way you do, and I assume you respect me too.
Oh, absolutely.
I just feel that definition covers it all for women. So I'll leave it at that.
Thanks, Tucker. Frank?
Yes, I mean, the more that we look at the language, I have like a question. So the amendment, and I'm just shuffling between the bills. So hold on, I'm going back. Actually, I think I put it here. The amendment says in section 12, 16 VSA, chapter 78, section or subsection 2501, section, thank you. In subdivision 5, by inserting before the period and support for the choice to carry a pregnancy to term. And so I was looking exactly where that is in the bill. So now I'm going there. And I noticed that, sorry, it's just like, takes a while to scroll back down there because I'm jumping between two sections of the bill because it refers to the beginning of the bill. And so I've been going back and forth trying to understand just like your point and everything and listening to everyone. And what I noticed is that in section 12, if I'm looking in the right place, subdivision 5 says reproductive healthcare services has the same meaning as in 1 BSA section 150 and includes medication abortion. And then you want to add and support for the choice.
Well, we're coming up with, Jen's coming up with something new, Brian.
So let's maybe hold it and have Jen put up the language of what, just hold on one second, because it is changing slightly. I know, can you just hold on? Because it might change what you're saying.
Right.
I don't think it will.
Oh, maybe not.
All right, go ahead.
Yeah, I don't mean to make trouble, but what I know, but as you're talking about the definition, I'm like, why did we put medication abortion in number 5 and single that out? Like, you know what I mean? Like that. Like
I see what he's saying.
Yeah, like,
I see what you're saying.
Like, so because people are saying to you, like, why? Yeah. So
Came from a very different.
Yeah.
Yeah. So I guess I just see the point.
You're saying you're talking about the other piece of it. Yeah.
I recommend removing that for unrelated reasons.
Okay.
All right, so we're going to turn this over to Jen.
Can I just, the point I wanted to make though is looking at this carefully, I just wanted to validate the point I heard, which is if you're going to single out one thing, why would you not single out another? I think we shouldn't single out anything. That's all.
Yeah,
Thank you. I just want,
agreed. Yeah.
So it originally came from Massachusetts language that was specific to medication abortion readiness in this section, and it was not reproductive health care readiness at all, and the Senate changed it. Reproductive health care readiness, they wanted to keep the reference to medication abortion. That's before we went into adding that language, so this is probably a change that we should have corrected while we were in this section, when we were looking at the bill, but I didn't focus on it until the amendment that we had from this committee on the calendar.
Yeah. Yeah, I think Brian's point's valid. Yeah.
I just was trying to hear you out and really looking at the language, and I just wanted to validate that it is a little strange that, yeah. And then I looked back at 1 VSA section 150, and I think that covers everything.
Okay, so let's look at the
Right, so
agenda.
here is the potential language, yes, sorry, Representative Morgan. So here's what I'm looking at as potentially a place to put the language if you want to add it or the member wants to introduce it. So reproductive health care readiness means each institution's preparedness to provide reproductive health care services to students or assist students in obtaining reproductive health care services, including having in place equipment, protocols, patient educational materials, informational websites, and training for staff, and then adding and providing support for students' choice to carry a pregnancy to term. So, and then it continues with its existing language. So that's where I was thinking as an alternative place rather than potentially creating confusion around the existing definition of reproductive health care services, about kind of making that the including part of their preparedness to provide.
Melissa?
By adding that, now I feel like we need to add more stuff.
Right. So
I'm not in favor of adding more stuff,
So I haven't spoken yet, because I try to let everyone else speak. And I will admit, I'm struggling with this one. First, I was all ready to not have it change the definition, but do this. I will say what Alyssa and Mari said was really important, especially what Mari said, that, you know, the right to carry a pregnancy to term is not under attack. Right to an abortion is under attack. And I don't even know if this is appropriate, but I would almost recommend that I would bring forward, can I talk about an amendment I might bring forward while we're talking about amendment?
Yeah, I don't think you have a motion on the table.
Okay. I would almost would rather, and I'd love feedback on this, bring forward a motion that we remove for medication abortion means an abortion provided by medication techniques. And we do not add this, and we rely on the fact of the reproductive health care definition that we put in, that is in section 1, that is reproductive health care. And as Alyssa says, it is all about pregnancy. That would be my thoughts.
That's all.
That's what you were conveying, Topper.
Yeah.
Huh?
That's what you were saying when you were talking to her. You were, yeah.
I think we got it. You take out that.
Thank you.
The medication piece that Lori was,
From a consistency standpoint, I think it's a good idea to take out that reference to medication abortion and the definition in section 12, but I recognize that's not the purpose of Representative Morgan's amendment. So I want to keep those, at least for myself, keep those a little bit separate.
So Brian, can I just hear from Michael before?
yeah, no, I mean, I agree with what Brian said. That was a component of it. When you see that standing alone, you're like, why? Why is just that talked about? So that certainly was a component of it, but also ensuring that, I think you're hearing me loud and clear, that this is a component of all of those services. You know, because I try to also think back, I'm not a young person anymore, but I'm not ancient, but I'm not young. I'm not a 20-something-year-old person that your average person is that's going through these things. But when you're that young, I think it's important to have a lot of clarity and a lot of definition. Everything that's on the table is clear and evident to you, because I just remember being of that age, a lot of stuff goes through your head, and and you really need to have a full spectrum of what's truly available and have that very well defined so that you make the very best decision for you, your spouse, your partner, whatever it may be. I don't know if that all makes sense to you, but I remember being 26 when first child was born. So I feel a lot differently at almost 62 than I did when I was 26 because it's called wisdom. I think we gain a lot of that as we age, you know. So, yeah, I think it's important because we're talking about most, you know, obviously younger people. We don't, my wife and I are going to have kids here at 62, but that ship has sailed. But anyway, I think you all hear what I'm saying loud and clear, but.
Right.
Yeah, I was gonna say that, I couldn't support the amendment, the re-amendment or whatever, the second amendment, not literally, but you know what I mean?
We did.
But like.
No, I'd like to talk about that with you.
That ship has sailed out of the city. That I couldn't support adding it in only because back to back your point, going back to 1 VSA section 150, it says reproductive healthcare services means all supplies, all services of a medical, behavioral health, which we'll talk about later, mental health, surgical, psychiatric, therapeutic, diagnostic, preventative, rehabilitative, or supportive nature, including medication relating to pregnancy. So that's all pregnancy. And then it says contraception, assisted reproduction, pregnancy loss management, or termination. So I feel like what it's saying is whether you want to prevent a pregnancy, support a pregnancy, manage the unwanted loss, or terminate a pregnancy, everything is covered. So just to validate your point, and that's why I wouldn't support it, because I feel like it's just unnecessary. So I guess I'm saying no to the amendment, and I hope that our chair will bring forward.
Okay, so we're gonna,
Take a strategic pause.
we're gonna vote on this amendment.
Sure.
I will say, if it is voted down, I will bring an amendment forward for the committee to discuss based on what we just discussed about for the medication abortion to be taken away, but nothing else is added and reproduction is reproduction.
Based on what Topper was saying.
Right,
Yeah.
yes.
Okay.
It's, you know, this is kind of, I've never been in this situation, so I'm looking to our legislative council. You know, if you want us to vote on your amendment, if you want to withdraw your amendment, if you want us to not vote and have us put our amendment forward and then you decide.
I could always withdraw mine on the floor, correct?
You want it, yeah.
I mean,
1 second now.
and you would have yours as well as what you're saying, Lori,
Well,
in addition.
I will work with Jen to bring something forward to the committee before the floor.
But we will have a chance to see the.
Yeah, absolutely. We will.
Before I vote on this one.
Let's do that. Why don't we hold this?
That's what I was, that's kind of what I'm getting at. I didn't want to see it just, let's do like a knee jerk.
Yeah, so let's hold this conversation.
Yeah.
I'll work with Jen on an amendment. We'll bring it forward because it would require the committee to vote like we did yesterday. You can also come on as sponsors if you want. But let me work with Jen on that. And then Daisy, I see you. I'll be right there. And then we'll bring you back in.
Sure.
And then we'll finish this conversation. Does that seem fair?
That's fair. I mean, when we deploy, we get combat pay. I mean, I feel like today we should get combat pay. I don't know. I'm like.
I'll get cookies later or something. Any other questions?
You can have free extra C rates.
Well, we just get a pro rata day. You don't get a full 30 day. You get 1 day.
Daisy?
I didn't have a question. I just had a comment, and actually it follows your combat pay comment nicely, because I was going to say thank you so much for coming by our committee and
Yeah, you bet, Daisy.
making what was potentially a really difficult conversation one that was actually really educational, and I felt really productive, and just thank you so much.
Yeah, I'm not a closed-minded person. I'll have any conversation with anybody, any day, all day, every day.
Great.
No problem.
Well, thank you. So we will be in touch when we're going to bring this up in committee. And I think for now we can go